supplement use before we kind of start to see a difference.
This is wonderful. So if you have someone in the house with special needs, we talked about the mask aspect of it. That's a challenge on its own. If they have breathing difficulties, now you have to get them to wear a mask.
That's right. And so a good alternative in that situation is a telemedicine appointment or visit. By doing the telemedicine, we are able to actually visualize the patient as well, which even though while they're not in front of you to where you can see them or touch them or get concrete values with vital signs and things, you are still able to visualize the patient, read their body language, and it's a good alternative when you're not able to get them out of the house or are struggling with other things like having them wear a mask, because that will often escalate behaviors and you're not going to get as good of an assessment on that patient. You'll be able to schedule into our Schedule 4 appointment. Within 24 hours of contacting us.
So Denise, the viewers want to hear more about you. Tell us about your background and the philosophy that you have.
Yeah, of course. My name is Denise Hernandez. I'm a family nurse practitioner. I've actually been a nurse for about 20 years and started off as a new nurse in critical care. And I spent many years, quite a few, 12 to 13 years in critical care before I went back to school. I graduated at University of Virginia with my bachelor's in nursing. And then when I went back to school for my master's, I attended Grand Canyon University where I got my MSN FNPC. Outside of, and I've practiced in a variety of settings, everything from critical care to urgent care, emergency room. I've worked in administration, family practice, and even a couple specialty areas as well. And the one thing that kind of crossed into all of these areas of practice has been treatment of chronic conditions and how those chronic conditions impact people. And what I really wanted to focus my practice on was being able to treat these issues before they actually become an issue.